What is next generation sequencing?
So, next generation sequencing is the current technique that we're using when we do most genetic or genomic testing in MDS. We're able to rapidly look at a very large number of genes in a rather quick fashion. So, it's usually a panel of genes that we're kind of looking to see if there are any mutations in maybe 100 or more genes, all basically with the same test using the same vial of bone marrow aspirate blood.
Basically, there's a lot of different methods that we use to look at the genetics of a patient. And so, we started with some fairly basic methods of detecting mutations. And next generation sequencing, to say it sort of simplistically, is just a more technologically advanced way of looking at multiple mutations at the same time. And so what it allows us to do is, rather than, looking at a single mutation, look at, a targeted panel, or, even potentially, all the mutations in a particular patient at the same time, and get that information to help us predict prognosis and treatment. So it really just is a more sophisticated way of detecting molecular changes in a cancer patient, I think, is the easiest way to sort of think about it. So next generation sequencing, or NGS, it can happen through a variety of ways. There's a lot of companies that basically perform NGS for sites, community or academic. So, they are pushing the boundaries of what we can do with molecular sequencing in patients, whether it's, rapid NGS. So, trying to get the information as quickly as possible in a matter of days, or, broad-based next generation sequencing where, we're not just looking at 40 genes, but we're looking at, like I said, all the genes that could potentially make up a cancer, and then figuring out, okay, what are the ones that are of interest now and what could be potentially of interest later. Some hospitals, some academic hospitals, have their own ability to do next generation sequencing in-house. And so they have a pathology team that then performs those for their MDS or AML patients. But I would say the majority of patients get their sequencing through a third-party company. And so, you get a bone marrow or on a blood sample, we send it off to a company that then sequences the blood and sends the information back to us to be able to use for these prognostic and therapeutic decisions. In general, for an MDS patient, we're thinking about 2 weeks is what we kind of expect for it to take to get the molecular information that we need. But, in my mind, and I think in a lot of, physicians' minds, is, in certain patients, can we do it quicker? So I think a lot of the companies are invested in, okay, let's try to do it in 7 days or 10 days, or even can we, do sequencing in 1 to 2 days? And I think if, we have a specific amount of genes that we're looking at, that's something that's pretty feasible to do it rapidly. But if we're looking at, everything, we're probably talking in more of a 14-day range currently in what we have. But yeah, if there is, what we consider therapeutic implications for certain sequencing, sometimes we will get a large genetic panel, and then we will get, a targeted panel that, comes back quicker, so that we can have the information we need to make those decisions earlier. But yeah, standardly, I would say, 14 days is what you should expect if you're a patient and getting a sequencing test at most places for MDS.